Okay,
Okay,
I think
got
I can start with yeah, a brief introduction of myself.
Yeah, you
Abel.
go
I'm
ahead.
based in Addis. Okay, I'm based in Addis here in Ethiopia. Um, Currently I work at the African CDC as a public health informatics fellow, and I also advise the Ministry of Health of Ethiopia on the emerging technologies and AI in healthcare. Before that, I used to work for a company called Mobi Health International, which is based in Nigeria, I think Abuja, and I think for about a year and a few months, I used to work as a chief operating officer and chief program officer. So I'll try to go through just a few slides on the area of digital health and health tech in Africa and how should we move forward? So, what are the components or the criteria or some of the ways we make sure that we have as a vendor and also as a policymaker, have a more of understanding of what worthy health tech should look like. The next slide. Okay, as you can see on my screen, we have, according to WHO, we have population of 1.4 billion. And we have a healthcare ecosystem or healthcare infrastructure where it's still not able to cope up with the growth of the population. And as you can see, 56% of the community or the continent population like adequate primary healthcare. And you see, so when you talk about problems, we're talking about also solutions. So as you can see, by saying that 56% of the population still needs primary healthcare service, we are also telling you or discussing on how we can actually bridge and minimize that gap. So this is where healthcare providers, maybe private companies, startups can actually tap into and come up with brilliant ideas that can actually work. Um, as of now, of all the companies working on startups working on digital health, we're able to capture for about $11 billion, which are raised by African healthcare and healthcare startups and startups working on the digital health ecosystem. So even the estimation, the next 5, 10 years projection is much higher, close to 35 to 50 billion USD. So there is a huge potential. We have uh, a need or unmet needs when we talk about the healthcare. And the physician to population ratio, the common number is 1 to 10,000, which is much worse in other specific countries as well. And there is a huge need for such kind of initiatives or innovative solutions to support and also close those gaps. Next slide. Okay, as you can see, this is more of talking about the ecosystem. Um, Currently, we have, if you can see, the digital health payment, mobile health, every EMR or every tool which is digital health enabled, currently is trying to penetrate the mobile device because, as you know, we have a population of more than 750 million mobile users or subscribers, and actually we can leapfrog from the desktop or this Windows applications into a more of mobile friendly and mobile first approach. Because this is we are late as a continent when compared to other continents when it comes to not only digital health but digital as a whole. So when you go to different sectors, be it the digital financial service and other sectors, you find them they are focusing more on the mobile environment and coming up with mobile applications to penetrate the market and also provide service. The other one is we are currently having a momentum when it comes to investment in digital health. And there are reports that digital health funding has increased from the 2020, even 2023 and 2024. Some of the countries which are leading this, we have Nigeria, Kenya, Ethiopia, SA, and currently the interest and also the focus is actually increasing. And the other one is the workforce enablement. So currently, community health workers are actually being supported and also empowered, where they are using different tools while they are supporting and working for the community. And currently, there are tools which are being deployed in different countries, or we call them member states, under the Africa Union umbrella. And the last one is currently there is huge progress when it comes to interoperability. We have different tools. They don't talk to each other. We have a siloed and fragmented ecosystem. That currently the government and stakeholders are actually thinking about and actually working on it. That they need to come up with a way. It could be a standard. It could be terminologies. It could be any tool that will help and facilitate the interoperability process and the interoperability vision, where any patient or any individual can have access to his or her data, be it in facility A, facility B, or facility C, so that we can have more of harmonization. Next slide. So when we talk about our initial topic, what makes health tech worth it, we have to think about different criteria. Different criteria, but understanding. Let's call them understanding. The first one should be such kind of solutions or any tools or any applications. They need to solve a real clinical or public health problem. So we need to have requirements, and those requirements should be based on the community's real need and problem. Otherwise, it will be very difficult then to call it as a solution and also taking it forward. The next one is it needs to work with the infrastructure people actually have. So a solution that works or that was a success in the US doesn't mean it's a success in Africa. So it needs to understand, adopt, and try to, I don't want to use the word customize, but co-design with the leaders, the policymakers, and even the clinician, the physician, the nurse within that specific community. And the third one is it needs to support, help, and reach the underserved population. We are talking about 56% gap where we have an issue when it comes to the primary healthcare coverage. So such kind of tools should support those issues. And the fourth one is it needs to generate more of usable data for health system decision making. So policymakers will come the next day and they will ask you, so you have been implementing or deploying this tool here and there. So can we have access to the data so that our strategies, our policies, our standards could be data driven? So it needs to answer such kind of questions. And the last but not least is we need to think about sustainability and not donor dependency. Because we are used to different donor support that last year after the USAID issue and the work order stop work order was issued, then it was very difficult for different ministries, agencies, governments to sustain it. because initially it was funding, and we have these implementing partners who are supporting these initiatives. So by the time it was closed, maybe 3 years or 5 years program, there is always an issue of sustainability because um, the systems were not built initially from day one for long-term sustainability. Next slide. Thank you. So when we speak about or discuss about building a worthy health stack, it could be ecosystem, a solution, or an environment. Three things should be in the consideration always. The first one is we need to design for community health workers, not only for the hospital administrator. We know for a fact that the roles and also the needs and the requests might be different. For example, for me as a hospital manager, I would only want to see the dashboard where I can, have insights into the number of patients, it could be the number of staff, and who is doing what. But for a nurse, it could be related to a workflow. It could be related to maybe entering the vital signs. It could be related to prescribing a specific medication to the patient. And the next one is it should, have, measurement of the impact on patients' outcomes, and not only, on download count or what we call just technical metrics, but we need to have KPI where we need to measure the impact uh, of such tools or solutions on the patient's recovery, discharge, or any related outcome, not related to the technicalities, but more on the patient outcome. And the last one is we need to build with African health systems, our continent health systems, and specific countries' health systems, and not around them. We don't need to customize, but we need to co-design, as mentioned earlier. Next. Yeah, I think this one is the last one. Yeah, Euromute.
Yeah, that was the last slide.
Yeah. So this is all about building a worthy health stack in our continent. And thank you very much.
All right, very nice, very nice. So, because you've got 3 minutes left before we need to transition, would you be willing to entertain one question?
Yeah.
Okay, very good. By the way, I'm going to give that question to Dr. Eke. Go right ahead. Please unmute.
Okay, thank you very much, Abel. That was a good presentation. I have two questions, not one, but maybe I'll wrap it up in one, right?
Okay, we got 2 minutes, so hurry up.
Okay, so the first one is, do we have any regulation to set standards for the development or design of these technologies for healthcare in Africa, in any country at all, or maybe continentally? And also, what measures are we taking to ensure that the data sets collected from these technologies remain on the continent and remain controlled on the continent, rather than maybe any stakeholder outside of the continent having control over it?
Okay, thank you so much. This is one of the major concern and questions we have been asking, and this is one of the suggestions we most of the time provide. The first one is every country, every nation must have its own standards, and be it data privacy, it could be standards on how a specific tool or solution should be designed. For that, we have some member states, some countries with their own EHR standard where it outlines the requirements, it outlines, except for the tech stack, it will not tell you how to build on what to build, but it will just give you more of a suggestion and recommendation that it must meet these criteria. And those criteria or suggestions are more of like when we are registering patients on the solution, at least it must have such kind of fields or such kind of recommended personal attributes which should be embedded within the system. So for that, we have different standards like HR standard. We have oh, we don't have that. Okay, yeah. I'm seeing your question. Maybe I put for the clarification here. Do we have any equivalent to the EU's MDR for design, development, deployment? No, for Africa as a continent, we don't have that. But the one close to that is we have more of country-based standards and frameworks which actually guide and help. Maybe that might have answered your question. And the next one is when we talk about the data sets and actually how they are entertained within a specific country. Every country, they have their own institution for what do we call this, data privacy and regulation when we have all these solutions. For example, I can tell you one example. We have in Nigeria, we have the Nigerian data, I think data privacy NDPM something, yeah, data privacy agency where they actually monitor how data is being shared among different solutions. And we go when we go to Ethiopia, and we have a policy called the personal data protection proclamation, which was actually enacted 2 years, close 2 years back, and currently it's being implemented by the different stakeholders, including the Ministry of Health. But when we talk about, okay, just 1 second,
Okay,
just
yeah,
on the data sets, still there is an issue. So Africa CDC and some member states agencies are trying to come up with how to entertain the ethical and the data sharing agreements when we talk about especially AI in healthcare and how to utilize those data sets. Thank you. Over to
okay,
you,
very nice.
Craig.
Thank you for that. And let me just make one 30-second point, and then we're going to switch to our next discussion. When we look at what Europe is doing, it's easy to kind of think that that happened quickly. Understand that it took the EU many, many years to get to that result. But often we focus on the result and we think, oh, that looked easy. And we don't recognize all of the years of work and effort that went into getting to that point. That is to encourage us as members of the African continent and diaspora that we should persist and accelerate down that same path if that's the outcome that we want to have for ourselves. So I'll leave that at that. All righty. Thank you very much, Dr. Abel. I really appreciate that, those perspectives.